we are going to go on a journey together, exploring the role that the psoas plays in pelvic tilt and just clear up any confusion between the motions that could be associated with pelvic tilt, such as hip hinge, lumbar flexion. And so we got to kind of separate those two motions and get clear on what pelvic tilt really is. And then also, what is the actual goal? What would be the best thing for your body? And then we're going to talk about the psoas. We're going to focus on that muscle specifically today and its role in achieving that goal or pulling you away from that goal. All right, so this resource that I'm using is from the University of Lyon in French. So this is the psoas muscle attaching directly to the lumbar spine. So this is the hip joint right here. And then we have its attachment to the lumbar spine. There's hip flexion, isolated hip flexion, no motion in lumbar spine. This is also hip flexion. And then what you just saw there was first a give in the lumbar spine, like a collapsing of the lumbar spine, and then hip motion. They're going to show the collapsing of the lumbar spine right there. You see that? Okay. So that will happen if the lumbar spine is not stabilized. When you go from basically doing a sit-up movement, if you watch this girl, she's going to do a sit-up motion there. That is not pelvic rotation. That is hip flexion. Only the hip is moving there. And it's only when we do a motion like that, that is pelvic tilt, anterior pelvic tilt. That has an effect on the lumbar spine. These are a good example of lumbar spine motion with a stabilized pelvis and without hip motion. So this is isolated lumbar spine motion. This is the type of thing that would irritate a lot of people's discs and back if you were to do this repetitively over and over again. This is not really the preferred way to move your body, is where all of the motion is just going into your lumbar spine. And then now you can see the person, they're doing extension and flexion, and you can see where the compression is happening on the disc. And so when we're talking about pelvic tilt, if we remember from earlier, pelvic tilt puts the lumbar spine into this position. If you have an existing condition in your lumbar spine, putting that motion in the spine repetitively over and over again by anterior pelvic tilting or posterior pelvic tilting is potentially going to cause friction in there. We don't really want to be constantly pelvic tilting forward, back, shearing the lumbar discs. We would rather, if we're going to be creating a motion in our body, using our hips rather than our lumbar spine. This is the motion of hip flexion without the pelvis moving. So the pelvis is not moving, the lumbar spine is not moving, but the hip is moving. And we call that hip flexion, lifting of the leg. But there's another form of hip flexion where the same joint is moving, it's the hip, and it's flexing, but now the leg is fixed and the torso is what's moving. And so this is what's happening if you are doing something like a deadlift. In a deadlift, your legs are fixed, but your torso is moving. It's still hip flexion. But notice the pelvis is not moving and the lumbar spine is not moving at all. But the psoas muscle could also do something else. And this is the key that's really going to determine the goal that we have. If we look at the lumbar spine, the psoas attaches directly to the lumbar spine. What's happening is instead of flexing the hip, this same muscle is contracting, but the hip is not really moving. What's actually moving is the lumbar spine. So this is causing movement, potentially compression and friction in the lumbar spine, where we have an existing issue. Maybe we have a herniation or a bulge or just degeneration. Excessive movement like this will potentially exacerbate it and irritate it. And so it's the same muscle contracting, but in one situation, the hips are moving and the lumbar spine is not moving. In another situation, it's the same muscle contracting, but the hips aren't moving, the lumbar spine is moving. So what do you actually want to achieve? We know that the psoas contributes to an anterior pelvic tilt. When it contracts, it's going to pull that lumbar spine into an anterior rotation, but it also does hip flexion. And so we want to be able to use this muscle. It's a muscle that's necessary for us to function. It's responsible for walking, for example. It's considered the walking muscle. It's going to pull your leg forward to take a step. And we need to be able to use this muscle effectively in this way, where it's flexing the hip, but not rotating the pelvis or not yanking on the lumbar spine, causing it to collapse. And that is a result of an unstable or unsupported lumbar spine. So if we can provide more support for the spine with the other muscles, the abdominal muscles, stabilize the lumbar spine so that we can lift our legs, like in this example, without the collapse happening. And the way to do that is by using the abdominal muscles to create this cylinder of stability. The hamstrings and the glutes don't actually stabilize the spine at all. They don't cross any of the spine. They go from the leg to the pelvis. So they can stabilize the pelvis in that neutral to posterior pelvic tilt. But once that pelvic positioning is good, you still have to stabilize up here, and that is done through the abdominal wall, the abdominal group. So this doesn't happen, the spinal collapse. And so now we bring the abdominals in, and we can see that they play a role in all of this process. This is posterior pelvic tilt. For some people that might be beneficial to try to reverse something like a spondylolisthesis, where the vertebrae slid forward. That's what I used in my strategy to get out of my spondy situation. It actually requires that they don't live in a chronic state of tightness to be able to have that be your posture. Why do these muscles get chronically tight? Well, compression is a form of stabilization. They're trying to compress this area of the spine because it needs to be more stable. Here's the iliopsoas, the psoas specifically. They contract, they compress the spine, they create stability for the spine, and they're super thick, deep muscles that you can see this like cuff, or the spine is just gloved in muscles on all sides. When the spine is needing support, these muscles contract. And if we can give the spine more support with this part of our core, all these muscles that form basically this pneumatic chamber, if these muscles become active, they can form the walls. In Mary Masterson's example, the Coke can analogy, and we can create pressure through our breathing and through containing the pressure inside our abdomen. That pressure is directly associated with stability. So increased pressure equals increased stability inside the system. And that would allow these muscles to be able to let go a little bit, not feel like they need to hold on to tension. So the more active these muscles are, not just the six-pack abs, these ones right here, here's one half and the other half would be right here, right? So these muscles are not really designed for creating stability. They're designed for moving the pelvis and the spine. They attach rib cage to the pubic bone. They cause spinal flexion. They are much farther from the spine. They have a longer lever arm, which means they create more motion. This is more of a movement muscle. We can take a look at an exercise like that somebody would often do with their abdominal muscles. This is a hip flexion exercise, right? The hips are flexing. In this case, the spine is being stabilized by the other muscles, and the psoas is able to pull on that lumbar spine, and the lumbar spine is not giving. It's not collapsing into a lordosis. The abdominals are what can stabilize the spine, and then be able to flex the hip, use the iliopsoas, use those hip flexor muscles to lift the leg or do a deadlift or pick up objects from the floor without that motion transferring into the lower back and causing that movement, that collapsing, that friction, and that compression. And so it's going to be the abdominal muscles that are the key to stabilize the spine so the psoas, the hip flexors, can do their job without collapsing that lumbar spine. So that's the goal. That's the understanding that I would want you to walk away with, is that it's not about anterior pelvic tilting as a strategy or posterior pelvic tilting as a strategy. It's about stabilizing that pelvis and stabilizing that lumbar spine and allowing your body to drive much of your motion, your functional movements from your hips, which is a joint that's much more designed for that activity and tolerating that load. We appreciate you here at Core Balance Training for leaning into your health, and it makes us want to lean back and give you more education and more of what's going to help you to climb out of the spiral of back pain. So until next time, get down on the floor and connect to your core.